All right, so now we're going to go into some of our temperature emergencies, and we're going to start with heat stroke. So the definition of heat stroke is a high body temperature, 103 to 105 degrees or more, and stress can cause the pet to go into heat stroke. Heat stroke is most often caused by leaving a pet in a confined space with little to no ventilation or water, especially during warm weather or high humidity. The temperature in a closed car on a hot day can reach as high as 150 degrees within 15 minutes. This is pretty common in our area here in Southern California, where the weather is so dry and hot the majority of the year. Heat stroke can also be caused by excessive exercise in warm weather, and as we in the grooming industry know, any of our brachyceptic dogs or brachycardia dogs, where they have the pushed-in faces, so our pugs, French bulldogs, regular English bulldogs, any of these breeds, Pekingese, they can suffer from heat stroke much quicker than any of your average dogs as well. So that's something to be aware of and think about. They don't even have to be out in a hot car. They can just have walked too quickly into the grooming salon, and if the kennel or the grooming salon is a little too warm, they can start to suffer symptoms of that. So we always need to be monitoring every pet in our care in the salon and making sure they're at a comfortable temperature, not in distress. Also, another note is that dogs bred for cold climates. Our Huskies, Malamutes, and with the super thick double or triple coats, they have a hard time here in Southern California when it's 110 degrees or more, and to keep an eye on them and their temperature as well and offer water and make sure they're comfortable. So our protocols for heat stroke are going to be to restrain the pet and keep safe, you and the pet. Muzzle only if absolutely necessary. A big way they're going to be trying to cool themselves is through panting and breathing hard, and we don't want to restrict that with them. If they're muzzled, you must cool the pet because it will not be able to pant and cool itself. Bathe or hose the pet with cool water until their temperature subsides. You can also place the pet in a cool, well-ventilated space and wrap it in wet, cold towels. Be aware of the duration of time that you're doing this for. You don't want to take, especially our small breed dogs, from being overheated and then overdo it with water that's too cold or for too prolonged time and take them into a hyperthermic issue where they're too cold. Hypothermic issue. You can, if you have the ear thermometers, superficially you can check their temperature, but again, we don't do any kind of internal temperature checking as it's not in our scope of practice. I believe for dogs, if they're at 105 degrees or more, the brain is literally beginning to overheat and cook, and that's when we often see seizures occur, is 105 degrees or more. So it's really important that we quickly begin to bring their temperature down and then monitor. All right, so burns, a lesion of the tissue due to heat or chemical burn. We often don't think of chemicals when we think of burns. We just think of heat-induced burns, but it can be chemical, electrical, or thermal. Burns can be caused by hot or caustic liquids, electricity, acids, and other caustic materials. Prevention is best in this case. If they're outside of a strange environment, we need to pet-proof our homes and shops and be sure pets don't have access to harmful chemicals or dangerous areas. We have 3 classifications of burns. The first degree burn, skin may be red and painful, need superficial wound care, and we're going to keep the pet from licking the affected area. A second degree burn, this is burned through the outer layer of the skin. This burn may be red and swollen, oozing a yellow or clear plasma, and it may blister. This type of burn runs a high risk of infection, so keeping it very clean is important. And then the third degree burn is a full thickness skin burn, so it's going to go all the way through the layers of skin, and it may appear charred. Sorry, I lost my spot. Parts of the hair and skin may appear charred. The risk of infection is extremely high in this case, so we're going to keep it as clean as possible. Our protocols for our first degree burn are to just cool the burned area with copious amounts of cool water. Depending on the surface area, the burn may heal on its own or may need some care. Watch affected areas to make sure it is healing properly. You do not bandage. And in our case, if it's not our pet and it's our client's pet, you still need to have them transported to see a veterinarian for vet care. Second degree burn, similar, we're going to flush with cool water. This type of burn, we do want a bandage to keep it clean and mitigate our risk of infection. And we're going to transport to the vet. Third degree burn, as the risk of infection is so high, we definitely need to get that dog immediately to a veterinarian for supportive care. Cover the wound with dry dressing, prepare pet and transport. We also want to be prepared to treat this pet for shock. Chemical burns, we're going to flush the area with cold water to remove any excess chemicals, determine the type of chemical. Pet may need additional treatment depending on the chemical. Baking soda can be used to neutralize burns caused by acid, and we're going to determine the severity or degree of the burn and treat accordingly and transport to the vet. Electrical burns, treat for basic life support, so airway, breathing, circulation, or ABCs, and transport to the vet immediately as well. So we'll hop into some of our cold injuries. I'm going to start with frostbite. Frostbite is freezing of the skin and tissue due to prolonged or extreme exposure to low temperatures. The areas most affected are ears, paws, scrotum, and tail. Does anyone guess why those might be the areas that are affected first?
They're the extremities.
Yeah, they're extremities
that hang off more.
Yeah, so they're further away from the heart. They're not connected to the body, so they get a little bit less circulation and blood flow, which would keep them warm and protect them from frostbite. So that's why they're some of the first areas. Skin can become swollen, red, and painful. It can also be hard and pale or even black. In later stages, the pet may lose skin and hair in the infected area. The lesion or affected area may look similar to a burn. In the late stages of the frostbite, the skin will look hard. So basically what's happened is that tissue and skin has frozen and it has died. It is dead. It's not getting circulation anymore, no blood flow to it, it's dead. So it's like sometimes we see the sloughing off of skin and hair in those spots because it's just dead and it's coming right off. With a frostbite injury, we're going to need immediate veterinary interaction. Just warming this pet up isn't enough because we do have dead tissue there. So now we essentially have a wound as well that's going to need to be treated by a vet for infection. So we're going to transport to the hospital, try to prevent any further pain, ward off infection, and obviously we are going to also try to make sure the pet's warm overall. Specifically, just frostbite is a localized area of frost or a cold injury, and next we're going to talk about frostbite, we're going to talk about hypothermia, which is overall cold. Alright, so hypothermia is a dangerous condition that occurs when the core body temperature drops too low. Mild hypothermia begins for dogs when their body temperature drops below 99 degrees or 100 degrees for cats. So earlier we were talking about vital signs. We talked about the normal range of temperature for dogs and cats. And so we know cats run a little bit hotter than dogs. So anything below 100 for them or 99 for us. They're still going to feel warmer than our body temperature. What's the average human body temperature? That's
98.6.
98.6. So this dog may feel warmer to the touch to me, but it's colder than they're supposed to be. And especially even if it's only at 99 degrees over a prolonged period of time, they could start to move into hypothermia and be too cold. While most dogs only experience hypothermia in cold temperatures, puppies, kittens, seniors, and toy breeds, as well as any dog suffering from
hypothermia.
Well, yeah, they'll feel hypothermia. What is the autoimmune disease? Thyroid disease. Pets with thyroid disease often also they're too cold too often. They have a hard time regulating their body temperature and keeping it high. So all of these pets are way more prone to hypothermia and being too cold. So damp and wet pets are extremely vulnerable to hypothermia. We're going to see signs of shivering, curling up for warmth, shallow breathing, low blood pressure or low heart rate, lethargy, and tiredness. Increased heart rate at first may occur because the body's trying to heat itself up and it's going to bump that heart rate up really high, and then you very quickly see the heart rate start to go below normal and become too low because it can't keep that up. Sluggish and delayed reflexes, pale skin and gums, and cool to the touch, especially in the ears and extremities. They may have dilated pupils, and eventually we'll see loss of consciousness. Our protocol to treat this, mild hypothermia can be treated with insulation and blankets, giving them just a place where they can be warm other than their own skin. Moderate hypothermia will require active external heat source such as radiant heater, along with the insulation of blankets and towels. And severe hypothermia requires invasive core warming, which must be done by a vet and involves IV fluids. All right, so seizures and convulsions. This is defined as the involuntary contraction of the muscles caused by abnormal cerebral stimulation or dysfunction. So the brain is not operating properly, and that's when we see the seizures occur. Seizures and convulsions can be caused by epilepsy, poisoning from a toxic substance, even small amounts of poison over time, like lead exposure, and head trauma. And then most commonly, head trauma seizures are caused by being hit by a car, a fall, or some major trauma like that. A seizure caused by poisoning is an emergency situation, and the vet needs to know the amount and type of the poison ingested, which we went over in poisoning. Pets may have a seizure due to stress and overstimulation, such as while being blow dried. So we all see that every once in a great while a barking seizure for a pet that's being blow dried. They've just become way too overwhelmed, and their stress level is not mitigated by them, and their brain cannot function normally due to that level of stress, and we'll see mild seizures that way. Signs are going to be falling, chomping and biting at paws, stiffening of the body, paddling motion of the legs, like the swimming in the air, jerky and uncontrollable movement lasting 2 to 3 minutes. We'll often see this indicated with the dog barking, and it is like a steady, uncontrollable bark that just goes on and on and on, and they almost look like they're not home, and they're just bark, 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 bark. You know, they're not in control of that situation. That is a mild seizure. And then, any uncontrollable movement lasting more than 2 to 3 minutes. Uncontrollable barking or screaming, accompanied by urination and or defecation. Prior to and after the seizure, the pet can have a low level of consciousness, be unresponsive, or not know who you are, or become irrationally aggressive. Also, their entire body, every muscle in their body has just been involved in the seizure and has convulsed very, very extremely for these periods of time. They're often exhausted after. It's usually sometimes not a good idea to continue this groom, even if it's something that the pet parent knows about and you know about, and it's a common occurrence for a small seizure. If this dog's too tired, we don't need to push. They're exhausted afterwards, as you can imagine. The other thing to be super aware of is the aggressive thing. When they come out of a seizure, they often have no idea who they are, where they are, who you are, and what's going on. It was like a year ago, had a small dog have a seizure. It lasted longer than I was comfortable with. I wrapped him up in a towel and started walking him across the street to the vet. And when I got halfway across the road, he came out of it completely and was lunging for my face, trying to bite me while I had him wrapped. Luckily, I had a towel and a lead on him, so I was able to contain him safely and keep myself safe. But it went from a dog I had groomed for years, who's my best buddy and best friend and super sweet and loving. He had no idea what he was doing, was not in control of it, and he would have latched onto my face if given the opportunity, because he just wasn't home in that moment. So always be aware of keeping yourself safe and others and the dog. And even though he was completely out of it when I started to leave for the vet, I still had a lead on him and a towel and was prepared to restrain him if necessary, and luckily I did. So our protocol for this is to stay calm. It's often a very ugly emergency to witness, and it's upsetting, so take a breath, stay calm. We're going to reduce all external stimulation. So if you're not able in that moment to shut off the light, shut down, I will often wrap a towel around the dog and walk into the bathroom and sit down, whether it's on the toilet or the floor or wherever I can go, to a dark, quiet room and just have sound and light levels gone. And I'll just sit quiet. I don't try to pet them. I don't say, are you okay? Are you okay? Just sit quiet and let them come out of it on their own in their own time with no outside stimulation. We often get really used to the noise levels in the shop, the light, situation in the shop, the dogs barking, the sights and sounds, and all the stimulation can be a lot for dogs that only come once a month or less. So we're going to mitigate all stimulation, give them a chance to come out of it. Do not restrain the pet or place anything in its mouth. We're not going to muzzle it when it's having a seizure. All we're looking to do is to keep it safe while it's having the seizure. You can't stop a seizure midway. You have to let them go through it and come out the other side. So we're going to keep them safe while that's happening because they're not in control. They can, move across a room if left unattended. So we're just going to at least enough to keep them from bouncing across the floor, running into a wall. Sometimes I put blankets under a large dog's head so that it's cushioned if it's bouncing a little bit and they're not hitting the floor. We're just going to gently contain and keep them safe while it's happening. Get rid of external stimulation. Clear the area of hard or sharp objects that might cause harm. If possible, pull the pet away from any objects that might cause harm and onto a blanket. As we talked about, you can loosely wrap them in a towel and hold them gently to protect them. When a seizure stops, start monitoring breathing. Go back to checking your ABCs, airway, breathing, circulation. Keep the pet comfortable in a quiet, dark place, and then give them a break. Give them 15 minutes minimum before you go back to reassess, what you should do next. If the pet has no history of seizures, it should be examined by a vet or animal hospital. Always stop the service, inform your manager, and wait for instructions before continuing. Note the duration and frequency of the seizure. One thing that's not listed in here is the definition of a grand mal seizure is that the seizure itself lasts more than, 1 minute, and it's more than twice in a row. So if it's one off, it's a little bit better, but if it continues or each seizure is for an extended period of time, it's definitely not good and you need to transport immediately to the vet. So as pet professionals, we need to observe and assess the pets in our care constantly with a clinical eye. Other health indicators to watch for are physical stance. Does the pet look or hold themselves as they sit, walk, and stand? Is it off from normal as they usually are? Are they favoring one side, won't put weight on a certain leg? If a dog has always been well behaved for a portion of its grooming service but suddenly becomes super uncooperative, maybe it's in discomfort, maybe it's hurt, maybe it's having a health emergency. Be observant and aware. We are often the advocating voice for the animals in our care. And the other last thing to pay attention to is skin and coat. That's the thing we specifically deal with and look at constantly, and we can see changes in. One of the first areas that an animal will start to show signs of distress, malnutrition, other underlying issues is on the skin and coat. Note any drastic changes in the pet's health, skin or coat, and inform the owner and recommend they see their vet.